transfer. So basically the patient can't stand up all the way. All they can do is like pop over. Okay, you'll see more of these with your spinal cord patients because they have limited ability, and if they keep themselves nice and compact, they can transfer over very nicely. But that's what a bent over transfer is. Obviously, with hip precautions and stuff, you can't pop like that. So it might be something like you might see a patient do this, so it's not a full stand, and they may also consider that a bent over, pop over transfer. Okay, pop over and bent over, just so you know, can be used interchangeably depending upon what facility you're at. Okay. You don't need that. So the first thing that you need to know is
You need this for the
probably. Okay. So when you line up your wheelchair, you eventually want to train your patients to line them up. Okay. For the purposes of when you're evaluating a patient, or the purposes of when you're doing with a patient, you probably position them in this manner, okay? And it should be, they say like a 30-degree angle, but you can use your judgment. You just don't want to be far away. So you want to get it so that it's on an angle, and then obviously the lock might get in the way, but, okay? Now this particular wheelchair doesn't have armrest, so it's good for pop over. And again, like I said, you might see it more with spinal cord injury kind of patients, but basically what has to happen is you have to educate the patient to, and this is another thing that sucks because hook plate doesn't move.
If you can't.
But you're gonna scoot to the edge. This chair is awful all around. So you'll have the patient scoot to the edge, okay? And then they would have to reach. The other hand is here on the frame of the wheelchair.
I'm going to put my foot
And
here
they're gonna
so that
pop
you don't
over.
roll away.
Okay? And that was literally like, you pop over. And then to get back, you always want to tell them you want to reach, make sure your wheelchair is locked, you want to scoot to the edge so that your feet are grounded, you're going to reach and pop. And what happens is, if their legs are in, see, I'm short, so it's hard to use me as an example, but if they're in a 90-degree position and they lean forward, there's no way that they can fall forward, okay? But if they're on an angle and then they do this and they have poor trunk control, then they can fall over. So if they're in a 90-degree angle and they lean, and this is what we teach spinal cord injury patients because they get nervous because they don't have a lot of trunk control. But if they lean and just shift their weight forward, they're alleviating their weight from their butt, which is so heavy because it's dead weight because they're paralyzed. And I use this as the best example because this is the biggest population you use this with. That you'll just, because you're redistributing the weight forward. I'm not very good at physics, but that's the way the whole physics things works if you think about it logically. Okay. Now, if a patient's never done it before, Katie, why don't you come sit here? Okay. And so now
She can't reach the floor.
Okay. No, sit back. Oh. So now Katie's here, and she has no ability to really move her legs or anything. I'm going to do my hook where I get close to her and I pull her. You feel pretty stable, right? Mm-hmm. Now, I do it where one leg is in between the other so that I have good support. Okay, and I'm always close to her because you don't know what they're going to do with their trunks. But if you've evaluated it, you know they're stable, then you may feel comfortable just to keep some distance. It's fine. So then I'm going to switch my position because now I want to pull the other side over. I'm going to wrap my arm around her torso, get my hand right underneath her knee, and pull her forward. And it really doesn't take that much effort to do, okay? Now what I'm gonna do is I'm gonna say to her, okay, Katie, what we're gonna do is we're gonna transfer over to the wheelchair. Okay, but actually, you have to do this for the practical stuff, just letting you know. I'm gonna say, hi, my name is Samantha, I'm an occupational therapist. What I'd like to do is get you into the chair. Are you familiar with occupational therapy? Let me tell you about it. Occupational therapy basically focuses on your daily tasks, the things that you were doing prior to your injury, all day long. Starting with the basics, bathing, dressing, cleaning, getting on and off the toilet, and out of the shower. And then if you went to work, you would work on those skills depending upon how you progress, okay? So you're explaining who you are, what you do, and why you do it, okay? So now, they don't know me. Now I'm transferring them, they're vulnerable. So what I'm gonna tell her is step by step. What we're gonna do is we're gonna try to scoot over a little bit more. So if she can't, okay, again, you're gonna get close and try to just maneuver her body. You're helping me. Oh, sorry. Get over, okay? This leg rest is in the way. You could move them out of the way, or sometimes with these wheelchairs there's a flip-up plate so you could get it out of the way, okay? And what you're gonna do is you're gonna position her so that she's in a good spot, and you're gonna tell her, because remember I told you that you want the patients to help you. You're gonna have her reach as you help pop her over, okay? So when I pop her, hold on, I just failed. Gate belt. But notice, and if you catch yourself before you do the transfer, you will not fail, okay? And I didn't realize it until after I went to put my arms around her, and I was like, oh wait.
But is that safe, like, with the Velcro like that? Like, it's so,
It is.
I feel like it's so...
But when you do it, it's pretty snug, right, Kate? Mm-hmm. You have to make it snug enough where you can still fit your hand in so the patient can breathe, but it's tight enough where you can grip them, okay? So you do like a finger test, you pull it. If it's too loose, you're gonna get points off for that, okay? You have to make sure you check the belt, because if it's too loose, it's gonna ride up, and you're not gonna have a secure grip on the patient, okay? Or
if you notice it's too loose, take it
yeah,
off.
you readjust it. Mhm.
No, you have to know.
You're doing all of this, Michael, before your task, before you do it. Like, this is the things that are running through your head. Of course, your nerves are going to be heightened because you're not used to doing this all the time, which is why I encourage you guys all to practice, practice, practice as much as you can. Do it at home, do it on family, do it on yourself. Like, just keep practicing talking, keep practicing, you know, what you will do, you know, simulate things, use a doll, whatever. Just practice, because that's the only way you're really going to learn it. I can't teach you more than just practicing, okay? So then what I'm going to do is I'm going to get close to her. So remember, I said that you want to hug the patient. I'm telling her, Katie, what I want you to do is reach for the frame, and you're going to wrap your hands around into the
belt itself, or the
and
loops?
also I no, I don't like the loops.
Okay.
I stick my thumbs through the belt so I know I have her, and I also have her pants. Okay, so I'm not giving her a wedge, but I have really good control of her. And what I'm going to say is on 3, what we're going to do is we're just going to pivot into the chair. Okay? Don't help me, Katie.
Okay.
Okay? So she's going to be dead weight, so this would be a max assist. Okay? She's going to hold on so that she has a grip, but that's all she's going to do. Because she doesn't have her leg strength to push.
What about her arm? Can she use her other arm?
No, because she's never done this before.
Okay.
So she's
I'm
a max
limp
assist.
noodle right now. Right?
Yes.
Okay.
So on 3, we're going to rock. 1, 2, 3. So now I got her on the chair, but she's at the edge. So now, the same way I moved her forward, I need to push her back, because in the wheelchair you have to make sure that her butt is all the way back so she's positioned